Hi everybody, welcome to Dr Manny's YouTube Learn Shops. This Learn Shop is about giving safe blood product transfusions, and this is part 1. As we've mentioned previously, these Learn Shops are all intended for healthcare professionals. However, in this situation, this is for healthcare professionals who are required to understand blood and blood product transfusions. So this Learn Shop will review the fundamentals that pertain to blood and blood product transfusions and practices that relate to it. However, remember that the guidelines are broad and every hospital has its own guidelines. However, it is meant to reinforce the Joint Commission International Patient Safety Goal number 1, identify the correct patient. So the learning objectives for this session are to do a pre-knowledge review, look at the components of blood, the functions of blood, the typical blood products that are available for transfusion, the indications that you would give a transfusion for, look at the ABO group system and the RHD blood group system. So let's do a knowledge review. Which of the following is the universal recipient blood group for packed red blood cells? O, A, B or AB? The correct answer is AB. Which of the following then is the universal donor blood group for packed red blood cells? O, A, B or AB? The correct answer is O. Which of the following is the universal donor blood group for plasma? OAB or AB? The correct answer is AB. When thawed, fresh frozen plasma should be transfused immediately or within which of the following time frames? A, within 24 hours if kept at 20 to 24 degrees centigrade. B, within 24 hours if kept at 2 to 6 degrees centigrade. Within 5 days if kept at 20 degrees to 24 degrees centigrade, or within 5 days if kept between 2 and 6 degrees centigrade. The correct answer is B. Which of the following is the shelf life for packed red blood cells if stored correctly? 5 days, 3 weeks, 2 months or 1 year? The correct answer is 5 days. Let's review some of the blood components now. Plasma typically occupies 55%. White blood cells and platelets less than 1%. Red blood cells 45%, the hematocrit. So what are the functions of erythrocytes, or the red blood cells? They transport oxygen to the tissues and carbon dioxide to the lungs. What are the functions of plasma? Plasma transports red blood cells, white blood cells, platelets, leukocytes, also known as white blood cells, clotting factors, nutrients, hormones and proteins, oxygen to the tissues. They also transfer waste products, metabolites from metabolism from the body to the liver, the kidneys, the lungs. What are some of the functions of blood? Well, we mentioned leukocytes, white blood cells. You have lymphocytes, macrophages, neutrophils, eosinophils, basophils. Essentially, we're talking about immunity. And immunity involves protecting the body from infections, from pathogens. And infectious diseases are caused by pathogens, which include bacteria, fungi, protozoa, worms, viruses, and even infectious proteins called prions. What are other blood functions? Well, we have the platelets, also known as the thrombocytes. And their role essentially is coagulation, which is clotting. It stops bleeding. So the primary function of a platelet is hemostasis, thrombosis, and it's involved in wound healing through a complex activation process at the site of injury, the clotting cascade. So let's review. Erythrocytes are red blood cells. What do? They deliver oxygen to the tissues and take carbon dioxide to the lungs to be excreted, exhaled. Plasma. Its role is to transport red blood cells, white blood cells, platelets, leukocytes, clotting factors, nutrients, hormones, proteins, and oxygen to the tissues. Also to eliminate waste products by taking metabolites from the body to the liver, the kidney, and the lungs. What do leukocytes do? White blood cells. They protect the body from infection, pathogens. Infectious diseases caused by those pathogens are eliminated. Thrombocytes, platelets, what do? Well, they're involved in the clotting cascade, and their primary function is hemostasis, stop bleeding. So what's the rationale? Why do we want to give blood or a blood product in a transfusion? First of all, anemia, to replace blood lost during any trauma like surgery or childbirth. It's to increase blood levels associated with genetic blood disorders or diseases, or as therapy. If you're bleeding, it's to replace clotting factors lost during any trauma again, like surgery or childbirth. And it's to increase clotting factors, the levels associated with genetic disorders, diseases, or as a therapy. So what are some of the typical blood products that are available in most transfusion centres or blood banks? You've got packed red blood cells, and they have a shelf life of approximately a month when refrigerated at 1 to 6 degrees centigrade, but you always perform a visual check to make sure that the product looks safe, looks normal. Fresh frozen plasma. Once it's thawed, it should be transfused immediately, otherwise it can be stored in a blood fridge for about 1 day at approximately 2 to 4 degrees centigrade. However, before transfusion, you always perform a visual check to make sure that it's okay. Colour, consistency. Then you've got cryoprecipitate. And cryoprecipitate, once thawed, should be transfused immediately as well. And it can be stored in a blood fridge for 24 hours at 2 to 4 degrees centigrade, as with plasma. Again, you always perform a visual check prior to transfusion to make sure the product looks normal, looks healthy, looks viable. Platelets. They should be transfused immediately and should only be stored for 24 hours at room temperature. However, they must be kept on an oscillating device to keep it moving, to prevent coagulation and clumping. And that's why you always perform a visual check prior to transfusion. Whole blood. Well, whole blood typically isn't transfused unless in an emergency. So, Whole blood is then transfused in situations where you've got significant or serious or life-threatening blood loss due to trauma or surgery. And this is for patients who need all the components of blood. And this comprises of red blood cells, white blood cells, platelets, and all of them suspended in plasma. And unfortunately, because you've got all these different types of components, there's a potential for incompatibility in patients with unknown blood types. So using the universal donor, O negative, eliminates that risk. It's the most universal of all the universal donors, O negative. So let's review. We have packed red blood cells. We have fresh frozen plasma. We have cryoprecipitate. We have platelets. Whole blood typically isn't available unless in an emergency situation where in blood group A, the antigens are A. Therefore, the antibodies are anti-B. In blood group B, the antigens are B. Therefore, the antibodies in the plasma are anti-A. In blood group AB, you've got both A and B antigens, so you won't have any antibodies in the plasma. In blood group 0 or O, the antigens on the red blood cell, you don't have any. However, the antibodies in the plasma are anti-A and anti-B. So let's review the ABO group system. In the ABO blood group system, the antigens and the antibodies for A are antigens A, antibodies anti-B. In the B system, we have antigens B, but antibodies anti-A. In the AB system, we have two antigens, A and B, no antibodies. And in the 0 or O group, there are no antigens, but you've got anti-A and B antibodies. So let's look at compatibility then. What is compatible with what? When we look at the ABO system with packed red blood cells and their compatibility, we have the donor and the recipient. So if the donor and the recipient are compatible, then donor A and A recipient, yes, they're compatible. B and A, not compatible. AB, because of B, not compatible. 0, they're compatible. When we look at ABO-B, A and B are not compatible, B and B are compatible, A and B are not compatible, 0 or O are compatible. What about the AB, donor and recipient? Well, A can go to AB, B can go to AB, AB can go to AB, and 0 can go to AB. So AB is the universal recipient. What about 0? A donor with 0 or O blood group and the recipient. So, A and O are not compatible, B and O are not compatible, AB and O are not compatible, but 0 and 0 or O and O are compatible. What about ABO and the plasma compatibility, which is now the reverse of the packed red blood cells compatibility ratio? So, with plasma, A and A are compatible, B and A are not compatible, AB are compatible, 0 are not compatible. With donor and recipient for blood group B, A and B are not compatible. B and B, of course, are compatible. AB can be compatible. 0 is not compatible. How about AB? AB and A, not compatible. AB and B, not compatible. AB and AB, yes, compatible. 0 or O and AB, not compatible. With 0, they're all compatible. A, B, AB, O. That's why O is the universal donor. When we look at ABO incompatibility, what actually happens? Well, first of all, you've got type A antigens on your red blood cells, which means you've got anti-B antibodies if you're group A. And we'll just be looking at group A in this situation. If the donated red blood cells have got a B antigen, remember type A have got anti-B antibodies. The type B antigens shouldn't be there. So what happens is the anti-B antibodies will mount an immune response against the B antigens. They shouldn't be there. They're a foreign protein. So what happens, the anti-B antibodies attack the B antigens, which causes clumping, agglutination, complement activation, thrombosis formation, and acute reaction. They attack. Clumping occurs, clots form, thrombosis occurs. And as a consequence of that, two things happen. You get massive hemolysis and you get thrombosis forming. You get an acute hemolytic reaction, which is potentially life-threatening. Now let's review RHD, the RHD blood group system. Now, simply what it basically means is you've got an extra antigen. Some people are born with an extra antigen, RHD positive if you've got it, RHD negative if you don't have it. If you've got the RHD antigen, you are RHD positive. It's present on your red blood cell in conjunction with your other blood group in the ABO system. If you don't have it, you're RHD negative. There's no D antigen present. So let's review RHD compatibility. If you're RHD positive, then you can receive RHD positive blood if you're RHD positive. If you're RH negative, you can give RH negative blood to an RH positive person. However, if you're RH negative, you cannot receive RH positive blood, but you can receive RH negative blood. So RH positive blood is completely forbidden to be given or donated to a recipient. However, there are exceptions to the rule, and if RH positive blood is given to an RH negative person, there has to be very timely management in order to avoid complications, as you'll see. But for us, RH positive blood can be given to RH positive recipients. Rh positive blood cannot be given to Rh negative recipients. Rh negative blood can be given to Rh positive recipients, and Rh negative blood can be given to Rh negative recipients. Let's look at the most common scenario that we all know, or should know, in relation to Rh-D incompatibility. The first one basically is you've got an Rh negative mother. This is her first birth. She has a fetus who is Rh-D positive. And as a consequence of that, sometimes fetal blood crosses the transplacental barrier and enters into the mother's circulation. The mother's circulation, her immune response, is activated against the Rh-D positive antigens. And as a process of that, her immune system will build up antibodies against any future Rh positive D blood cells. So if she becomes pregnant again and her fetus is Rh-D positive, she'll mount an immune response against Rh-D positive red blood cells. And as a consequence of that, what will happen, the mother's antibodies will cross the transplacental barrier and start destroying the fetus's red blood cells. They're a foreign protein. For example, now you are having a blood transfusion. So you've got an Rh-D negative patient, and this is the first transfusion. They can have Rh-D positive blood, but there's a problem. They end up having the Rh-D positive blood, and after the transfusion, Rh-D positive antibodies are generated by the patient's immune system. They won't have a reaction, or if they do have a reaction, it may be minor, but any subsequent transfusions of Rh-D positive blood, there will be an acute transfusion reaction because the antibodies have already been generated in the first transfusion or following the first transfusion. Rh-D positive incompatibility. If an Rh negative person does have Rh positive blood administered, or as in the fetal situation, anti-Rh-D immunoglobulin has to be given within 24 to 72 hours after the Rh-D positive blood is given to an Rh-D negative patient to prevent irreversible anti-Rh-D positive immunisation. Once the mother is immunised against her future babies that are Rh positive, there's nothing she can do about it. Once the patient has been given Rh positive blood and they're immunised against the Rh-D positive red blood cells, there's nothing you can do about it. So let's review. ABO transfusion compatibility. Which of the following regarding Rh-D positive blood is correct? A positive donor blood is compatible with an A positive recipient. Yes or no? Correct. B negative donor blood is compatible with a B positive recipient. That's correct. An A positive donor's blood is compatible with an AB positive recipient. Yes or no? True or false? Correct or incorrect? That's correct. an O positive donor's blood is compatible with an O negative recipient. True or false? Incorrect or correct? That's incorrect. They'll develop antibodies against the O positive blood. O negative donor blood is compatible with an AB positive recipient. That's correct. The universal donor. The universal recipient. So let's summarise and review. Which of the following is the universal recipient blood group for packed red blood cells? O, A, B or AB? The correct answer is AB. Which of the following is the universal donor group for packed red blood cells? O, A, B or AB? The universal donor. The correct answer is 0 or O. Which of the following is the universal donor group for plasma? O, A, B or AB? The universal donor for plasma is AB. The opposite of packed red blood cells. When thawed, fresh frozen plasma should be transfused immediately or within which of the following time frames? A, B, C or D? The correct answer is B. Within 24 hours if kept at 2 to 6 degrees centigrade. Which of the following is the shelf life for packed red blood cells if it's stored correctly? 5 days, 3 weeks, 2 months or 1 year? Stored correctly is in a blood fridge. The correct answer is 5 days. So thanks again for following this review. This has been part 1 of safe blood and blood product transfusions. Now, if you found this to be in any value to you, go to part 2 and subsequently after that part 3. Please, if you found this of any value or you think that your colleagues might benefit from it, please review and offer it to them, or maybe subscribe. Thanks a lot. See you next time.